On this episode of the Athletic Potential Podcast, we will be discussing quick tests that we use to determine injury risk for our softball players and our baseball players, as well as how we recommend or go about decreasing arm stress with throwing. Welcome to the Athletic Potential Podcast, your place to come and get answers to your athletic development questions. We cover a range of topics, all related to helping you to achieve your athletic goals so that you can experience and enjoy the athletic career that you deserve. I am your host, Dr. Mike Matthews. Hey everybody, and welcome back to the Athletic Potential Podcast. We're excited to be here with another episode. Appreciate you taking the time to be here. We are kind of going into an interesting part of the season here at Athletic Potential, where we're seeing a lot of our professional baseball players start to ramp up and get ready to report for spring training. And there's been some interesting questions that have been asked over the last couple weeks. And we're going to discuss two of those questions today. We're going to forego the case, or our normal format, as we usually talk about a case, typically the last patient I treated prior to the recording this episode. But today, I think we're going to go ahead and just jump right into two of the questions that I've been getting very commonly over the past couple weeks, and dive into those a little bit more. And I think you'll get some good information from this, but also I think some good things you can take away that may be able to help you if you're the athlete who's specifically more of a thrower, or if you're a parent of an athlete who's a thrower, and try to help them. So we're going to jump right in. So the first question comes from Jared, and Jared asks, in regards to screening players prior to the start of a season, are there any easy or quick tests that can be completed on the field that you feel like help to identify those that will become injured? I am a coach of a youth baseball team, but also have a lot of interaction with softball players as well. So I'd appreciate your thoughts on either baseball or softball. Thanks. So Jared, you asked a really great question. Screening and looking for injury risks before the injury happens is something that I talk to people all the time. It is something that I do consistently here at Athletic Potential, and I'll be honest, it is actually one of the main things that when I do an evaluation for a client that comes in, whether injured or not, we are always doing testing to determine whether or not they are essentially suboptimal or even, significantly at risk for a future injury, because it is much easier to take care of any problems before it becomes a major injury than after the player's been injured. So, and I think that's kind of more of an obvious statement, but just to be very clear, one of the things we do here at Athletic Potential is we really target inefficiencies or areas of suboptimal performance, and really try to improve upon those, knowing that two things will happen. More than two, but really the two main things will happen. First, we'll see a definite improvement in that player's athletic performance. And secondly, we are going to definitely see an improvement in that patient's or that client's durability, or they're just not going to become injured most likely if we are able to address these things. And so this is a great question by Jared about what tests we use. Now, I can tell you this, and we're going to start kind of a brief overview of what we look at here at Athletic Potential. But then I'm going to also answer your question more directly, Jared, of some easy tests that it can be done on the field in a practice, and then a little bit of what maybe can be done to help, improve or decrease that risk of injury for those players that may not test very well. So it's one thing to know and to test. It's another thing to not do anything about it. If you just test and it's like, oh, you're at risk, but you never do anything about it, this doesn't really do you much good, right? So, all right, Jared, let's get into this. So at Athletic Potential, let me walk you through what happens. The patient will typically, or a client will typically come in, schedule an evaluation, and they'll go through a series of tests. The first thing we look at is a general movement screen. So we look at them basically standing, they move their head around, they move their thoracic spine around in certain directions, they bend over, touch their toes, they bend backwards and arch their back, they rotate in both directions. Then they take their hands, reach above their head, reach behind their head. So you reach above their head, reach behind their head, and then reach behind their lower back. They then stand on one leg, trying to pull their knee up to their chest without using their hands. Same thing on the other side. And then we have them balance on each leg as well. We then have them do an overhead squat. And then we also have them do a hinge. And that is the movement screen. And we call that a base level movement screen or a foundational movement screen. They get graded upon that, essentially in a red, meaning we see substantial problems or substantial movement compensations, or they have pain. A yellow, meaning we're seeing some things here and there. They're not terrible, but they're obviously things that aren't great. And then we have green, meaning that they move very well and very fluidly and everything looks normal. Now, from there, we jump into our next level of testing, and that is basic range of motion testing. And you asked the question more specifically to throwers, Jared, so I'm going to answer this more specifically to throwers. Is we are always taking range of motion on the shoulder, on the elbow, on thoracic rotation, and on and on hip rotation. My apologies. And we look at hip rotation. Hip rotation is something we've been doing more recently. We didn't target it directly, but what we're starting to see is a correlation between some things that suboptimal areas and things that we just have noticed in our throwers that if they don't have optimal hip rotation, it seems to affect them down the road. And so we'll look at range of motion there. We'll get quantifiable measurements there using goniometric measurements. Sometimes we measure that through video measurements. We'll do a video, film them moving, and then take them through passive range of motion on the video and measure it that way. And sometimes we'll do basic goniometric measurements on the table. And then once they are done with that testing, we then go one of two ways. One, if the client has any type of pain and or injury history that needs to be addressed, that is the road that we go down after that. That typically takes the rest of the entire first session to make sure that we go heavily into any medical history or injury history or current pain that needs to be addressed. If they do not have any pain and don't have substantial injury history, then we'll go to the next phase of this, and that is strength testing using dynamometers. So we actually get physical measurements and numbers. And we compare the numbers depending on the age of the client. We compare this number either to established norms in regards to strength, or we compare it side to side. And we test everything in the shoulder that you probably can think of, flexion, extension, rotations in both directions. We test in different positions of the arm up again, away from the body, pulling and pushing. We test those as well. We test elbow flexion and extension. We test ulnar deviation. We test grip strength. So we get numbers on all of those. And once they are done with that, we go to we kind of work our way down the body a little bit, but we go now at this point, we go down to the core. I like performing a 2-minute plank test. For those that know, have trained with me or been around me, I don't like planking for longer than 30 seconds. There's a lot of some research that backs that decision up. But on the test side, I will have them try and plank for 2 minutes. I got this from Dan John, and I can tell you this. It is highly effective at telling me a lot of different things in a very short amount of time, so in like a 2-minute interval. So, Jared, really quick, put a star next to 2-minute plank because you're going to hear me mention that later in regards to quick tests. Okay? So I'll do a 2-minute plank depending on how they do. I'm taking notes at this point. It's not, did they get 2 minutes or here's their time. It's more like, yes, this is their time, but here's where they broke down first. Here's where I'm seeing compensation patterns. And it just kind of gives me an idea, lumbopelvic or that area in the core, what they need to work on. So areas of suboptimal areas. It's really difficult to test the core outside of some endurance testing. But when it comes to core endurance and core strength, all that stuff, it can actually get quite difficult to test. I know there's ways to do it, and if you know how to do it, it's really not that difficult. But I found in our setting, it's not something that I like to test because I don't feel like we get great results. And maybe we're just not good at testing it. But we found the 2-minute plank is a great way to test that. Okay, so once we are done with the core testing, we will then move on to balance testing. This is standing on one leg for 15 seconds. Eyes open, standing on one leg for 15 seconds. Eyes closed. Jared, put a star next to the last two things I just said. Eyes open, eyes closed, standing balance, single leg standing balance. These are very informative tests. We do know, based on some of the research, based on more of like dynamic balance, that those that have poor dynamic balance are at increased risk for shoulder injury, and we're talking more specific to throwers. And so I always think if they can't even stand on one leg with eyes open and eyes closed, a dynamic balance test is probably not going to go very well either. And so this is an easy base level screen. If they cannot balance on one leg for 15 seconds, eyes open, and then again 15 more seconds with eyes closed, I start to worry about their ability to move effectively enough to decrease the stress on their arm when they're throwing. And a note on this, the younger the athlete, the more leeway I give. So if they don't balance well and they're 12, okay, I'm not going to put so much weight on it. Now, it's still weighted. It's an easy thing to train, and we can get substantial performance benefits, not only injury risk benefits, but performance benefits by improving balance. But if they're 15, 16, 18, like these are big time problems that we need to address. Okay. So balance testing. Once they are done with balance testing, we move on to movement, or at this point, performance testing. How far can they jump? Standing broad jump. Okay. Jared put another star, another star next to standing broad jump. If an athlete cannot jump at least their height, that is a sign that I'm a little worried that they have some force generation problems. And what we have found that, in total anecdotal, maybe there's research out there, I haven't seen it yet, but on our end of it, if an athlete can't jump at least their body height, so their distance in body height, so if I'm 6 feet, they should be able to jump 6 feet. What we have found is that these athletes typically are compensating for a lack of strength by trying to generate force more in the arm, and that increases arm stress, and therefore potentially increases risk of injury in the throwing arm, not to mention other areas. So again, anecdotal research, nothing great there. It's just something that we've noticed and seen a little bit of a trend of, and it's something that we want to address fairly quickly. So again, standing broad jump, Jared, star next to that one. Hopefully I can get all these that are starred. If not, go back to the podcast and just go through the ones that I've starred. But I'll try to bring it back to a nice little summation test here. Okay. So standing broad jump, we'll measure that. We'll measure a med ball throw toss. We measure that two different ways: distance or velocity. If they can throw the ball hard enough to be registered on our radar guns, then we'll use velocity. If they can't, then we'll use distance. The last thing that we typically test on our initial evaluation that is more towards risk, injury risk, essentially classification, is their ability to carry a weight a certain distance. I'll be honest on this one, Jared. This is not the one that I feel like tells us the most. It's something that I've added in only because I feel like if I can see how these kids can carry weight, I feel like it gives us some data, right? You'll see the kids, they'll pick up weight, equal weight on both sides. So say 30 pounds on each side, I'll tell them to walk 10 yards and they'll start to walk, and you'll see a bunch of stuff. You'll see them like arms drooping, posture gets really bad. That indicates that they just have really bad core control and stability. You'll see that they're like hiking one side up and the other side's really drooping down. Well, that means that they're fairly asymmetrical. You'll see kids that they're just barely gripping these weights, right? They can barely hold on. Their fingertips are the last thing on there. Well, that's a grip strength problem. It just kind of tells us a lot. In regards to risk stratification, I don't know how much it tells us. But if I have an athlete that can pick up a weight, and the weight's all based on body weight, that is how much weight we give them. If they can grip the weight, walk for 10 yards, make it look good, the older they get, the longer they go, 20 yards, 30 yards, and make it look good, then I feel like from a general base level of strength, let's use the term aerobic capacity. I feel like they've probably got a good base of aerobic capacity that we need to work with. We do know that aerobic capacity is associated with an increase in injury risk generally. So those that are, the common world, basically we say aerobic capacity, just in shape is what most people would classify that as. Like, I'm not very in shape. Well, your aerobic capacity is probably not very good, right? It's the same statement. And so the kids that seem to have decreased aerobic capacity are the same kids that don't look like they're in shape. And you can just see it in the way they move. They don't move well, or they can't handle loads, or they can't move quickly, or they have a hard time moving side to side, those type of things. So anyway, so a carry. So that's not, it's something you could test, Jared, but I'm not sure it's going to give you what you want. And I don't know how effective it is at managing risk of injury. So that's a day one. I won't go into day two. It's another, just a long list of other things that we test. It becomes very individualized at that point based on anything that we found that kind of fell out of the normal ranges, as well as we also address injury history at that point. And if they haven't had injury history or anything like that, then we address a couple other things. So we won't go into day two, but there's a whole nother list of testing that we do. It doesn't take the entire time, but it takes most of the time. So that being said, let's go back here, Jared. Let's build you a nice little list of quick tests that I feel like if I only had a short amount of time and I'm not trying to get perfect numbers here. Here's what I would do. Well, I would have them do the basic movement screen. That one's pretty easy. Okay. They need to be able to lift their arms above their head. Arms straight. If they're not even, that's a problem. If they can't get their hand, they go by hands behind their head. Okay. Elbows out to the side. They should be equal on that. If that's not the same, then that's a problem. They should be able to reach both hands behind their back. I don't care how high their hands go. I just care that they meet their hands together in their back, and they shouldn't be all asymmetrical. Okay. So there's that. That's the only on the screen of that I would do. Don't worry about them touching their toes or arching their backs or stuff. I think it goes beyond what we're trying to get done here. So there's your first thing. So arms up, arms behind your head, arms behind your back. That's your first thing. Second thing, I would have them do a 2-minute plank. Yep. 2-minute plank. I think you're going to see some pretty good, I think you're going to see some pretty good information there. If they can't maintain a 2-minute plank, they need to get stronger. If their middle, if their plank is dropping but in their midsection, then it's a core endurance problem. You need to work on core endurance. So you know that they've got a core endurance problem. Okay, so 2-minute plank. Following the 2-minute plank, they're going to stand on one leg for 15 seconds, eyes open. And if they can't do that, that's a problem. And then they're going to go eyes closed for 15 seconds on each leg. If they can't do that, also a problem, something needs to be addressed, and we'll talk about that in a minute. And let's stay with those. I probably had one more in there that I told you to put a star by. Realistically, I have an 11-year-old softball player. This is what I have our team do. I haven't broad jump, so I probably haven't broad jump. That was the only one I was thinking of. I'd have them broad jump and just see how far they can jump. You don't have to measure it out. I'm lay down and then stand up and then jump it. I mean, you could, but I just have them jump it. If it's close, it's close. If it's not, it's not. You'll see it. Okay. And there's plenty of things you can do to improve those poor tests. If they have, I'll be honest, if they don't have good range of motion in their shoulders in any direction, and it's really bad, they need to see somebody for that. We got to figure out why. That's not something I don't think cranking on it and anything like that is going to be helpful. I think it's only going to hurt kids at that point. I wouldn't do that. And in regards to balance, just tell them to, when they're brushing their teeth at night and in the morning, to stand on one leg and brush their teeth, and then at night stand on one leg, brush their teeth, and close their eyes. It's probably the easiest, most simple way for, and I'm thinking like kids, and even teenagers can do that, and they'll probably see some pretty good improvements. Planking, you could literally just do a plank on your hands or plank on their elbows for 30 seconds, 15 to 30 seconds. Get really good at it, and really good form. Do 1 to 3 sets, maybe 5 seconds of rest in between each set, making sure that plank form is really pristine. And then broad jumps, realistically, just get them jumping. You know what I mean? Just have them do more of it. It's typically in the sense that they just need more exposure to it and learning how to jump and land. These are really basic, but yeah, Jared, I hope this answers your question. These are basic tests that we use in Athletic Potential to just kind of screen a few things out. But realistically, they can be done on the field anywhere. And if you have kids that are just not, and players that are just not really performing very well in these tests, it's something that I would consider you need to address. And it may just be like, hey, Billy, you did not test well in your plank, so I'm going to have you go home and you're going to do 3 sets of 15 seconds of planking every day, and Janie, you are not good on your balance, so I need you to brush your teeth standing on one leg and then make sure you're switching every 30 seconds, all right? And just work on that. It's that simple. It doesn't need to be more complicated than that. When I say that, okay, as they get older, it probably needs to be a little more sophisticated than that, but not a ton. I think the idea here is that if you get good repetitions in, that's the key. Yeah, I think that's where I'd start. Okay. I hope that helps, Jared. This is a category. I mean, there's tons of research out there on what to test for and what does it mean and all these type of things. But I can tell you right now, the key is good movement first. Your players need to be good athletes. They need to move well. If they don't move well, they're automatically at a slightly increased risk of injury, period. If they're moving well, then you can get into the nuance. Throwing is a very specific motion. It's a very specific skill, and therefore we can test very specifically for it. If you're worried about ankle sprains and those type of things, get good movement, teach good movement, teach them to move. If you need somebody to help you with that, find a good coach, those type of things. Yeah, Jared, I hope it helps. It was a great question. Very, very good question. I appreciate you reaching out and asking that. All right, our next question comes from Hank, and he asks a really good question and kind of another one of these questions that if we really knew the answer to, a very specific answer to, it would be being performed everywhere. And you'll see as we get into this that there's a lot of good answers to this question, but I'm going to give you the one that I feel like we have seen most consistently that answers it. So Hank, let me get back to the question. Hank asks, is there something that you look for specifically in your throwers that helps to decrease arm stress with throwing? Yes. We just talked, Jared asked a great question in regards to, screening and all those type of things. Again, when we talk about, let's define arm stress. So arm stress can be a lot of different things, right? And when we talk about arm stress, let's define it as basically shoulder and down the arm. So we're talking, elbow, wrist, hand, and shoulder. Okay, so these are the stresses that go through the arm as you're throwing a baseball or softball, javelin. Doesn't matter what you're throwing. It could be hitting a volleyball, any of those things. Okay. So one of the things, there's a lot of components to this, Hank, but let me tell you this. Let's do it this way. If I were to ask you which player has more arm stress, and we'll say player one is a football quarterback, and player two is a baseball pitcher. The question is, which one do you think generates more arm stress? Now, a lot of people would probably say along the lines of, well, most people nowadays would be like, well, baseball player, right? Because the injury rates in baseball players are substantially higher than footballers or football quarterbacks. Yes. So that makes sense there. But let's put it this way. Let's make the argument that the arm stress in a quarterback throwing a football is higher. Like there's more arm stress there. And it's a very similar motion, obviously a different implement. Okay. And that makes all the difference here. So, and I apologize. I should have looked this up before answering this question, but I don't have it, and I apologize. Therefore, I won't give any specific numbers in regards to the baseball side either, just because I don't want to get them wrong, but I have a general idea. But the idea, here's the deal. When we talk about arm stress, it's typically measured at the elbow in regards to angular velocity and then therefore torque. So the higher the elbow torque, the more stress, the more arm stress, the more stress the elbow takes in that throwing motion. And the shoulder experiences also torque, and it has its own variableness to that as well. And so therefore, when we talk about it, you have to look at these physics equations, right? And without getting all into that, basically the higher the speed, the higher the angular velocity, typically the more of the arm stress. Okay. Now the weight of the implement, the mass of the implement makes a difference. Okay. And what we have found, and if you're a quarterback in football, you're throwing a football that typically weighs around 17 or 19 ounces or something like that. If I got that wrong, I apologize. It weighs more than a baseball. Okay. Baseball is a 5-ounce ball, right? And so you're throwing essentially a 1 pound, just over 1 pound ball. Okay. And a very similar throwing motion. Okay. And so the angular velocity with throwing football is less than throwing a baseball. And you could argue that because the weight's higher, there's more stress going through the elbow and the shoulder because of that. The weight is heavier, and therefore that mass takes more force to move, and so therefore your stress levels have gone up. And the answer is that's actually kind of true. There's truth in that, right? However, what we found is in baseball players, their angular velocities are substantially higher, and therefore they experience more arm stress. Okay, so we're going to standardize this a little bit. All right, so just to kind of give you that idea, right? So we measure arm stress based on how fast the arm is going to rotate. Let's simplify it to that. All the biomechanists in the world just kind of roll their eyes like, oh my gosh, there's so much more than that. That's true. But Hank, I'm trying to answer your questions to kind of give it to you. Ways that we are going to decrease arm stress on our throwers. Okay. Now, our throwers are going to be baseball, softball players. Okay. There's javelin thrower, jab throwers. That's a different weighted implement. It's a different, thing. But I think the concepts can be applied. Same thing with volleyball hitters. Same concepts can be applied here. Okay. And what we're really looking at, and you're asking what is the most important or what's the most specific thing. There's a lot of things, right? But I can tell you this. When we have an athlete come in who's a thrower, tiered athletic potential, there's a couple things we look at. Obviously, I went through with Jared all the things we test for, okay? But I can tell you right now, one of the things that we look at is I pull film on how they throw, or they throw for us, whether here we throw with them, we video them so we have an idea of what they're throwing. We typically measure velocities of throwing depending on the time of the season, like those kind of things, because that's how we measure outcomes, right? But realistically, Hank, what we're looking at is we're trying to determine, and we don't just film one throw, we film multiples, 3, 4 throws, okay? Is we're trying to determine, one, is if there's any major problems in their throwing mechanics, right? Stuff that is just not good, that needs to be addressed. We look for that. The second thing we look at, and which is the thing I'm going to kind of lean towards here with you, Hank, and that is, of the 3 to 4 throws that we film, how consistent are their throwing mechanics throughout those 4 throws? Okay. Now, before we get too far into it, this is how we test for this. Client goes out, they warm up, they throw all these throws. We feel like they're good, and we say, okay, here's the deal. For the next 4 to 5 throws, we need you just to Throw like you've been throwing. Throw fastballs only, okay, and try to put it on a nice line to your partner's chest, okay. So they have a direction. They're trying to put it somewhere. It essentially kind of standardizes what they're trying to do on their end, okay. You say don't do anything weird about it. Just straight to your partner's chest on a line, okay. And they're throwing 60 feet, okay. And so they go, we film it, and then we look at consistency of their mechanics. Can they repeat the same throwing motion over multiple throws? I can tell you this, and I can tell you this has been the case in regards to our higher level throwers, our pro guys that come in, is one, if there's any crazy biomechanical stuff that's just not good, then we fix that. Okay. Two, if it's repeatable mechanics now, can you repeat the same mechanics of throwing throughout with each throw? Okay. Now, obviously, it's going to change if you're on a slope and all that kind of stuff, but we can get to that later. But the idea is, can the athlete reproduce the movement consistently over each throw? If they can't, then we're talking about problems in regards to arm stress all the time. Because if they're all over the place posture-wise and they arc here and then the next throw they're kind of hunched over, the next throw they're really leaning forward or whatever it is, they're going to increase arm stress because they're not going to be able to find that nice groove of throwing that allows for the whole kinetic chain, the whole body to produce force, produce force into the baseball or softball. Okay, the same thing happens with the windmill pitch too. Okay, it's repeatable mechanics. We look for their ability to repeat their mechanics. If they cannot repeat their mechanics, they have to learn to be able to repeat mechanics. I can tell you, everybody here at Athletic Potential, if they're a thrower and we feel like their mechanics are either there's gross like when I say gross, I don't mean like nasty. I mean like obvious big things, right? That need to be fixed. They go see a pitching coach. Second thing, if we can't get them to repeat their mechanics during their throwing progressions, we send them to a pitching coach. We send them to a throwing coach, whoever it is. Now, we're lucky enough that we work directly with a lot of coaches, and they're easy to get to, and they're very good, and they work with our process. It's great. And I can tell you right now, it has absolutely helped our outcomes for our clients. So it's one of those things, Hank, when you're talking about it, there's a lot of factors that go into throwing and decreasing arm stress. But I can tell you right now, I can make a player's shoulder rotator cuff extremely strong and have really good endurance. But if they are not if they are not consistently putting their arm and their body in a position to use the strength and endurance of the rotator cuff, it doesn't matter. The arm stress is going to go up. Okay. So they really need to have good mechanics first, and they need to be able to repeat those mechanics. And if you don't have that, I highly suggest finding somebody that can help teach that to your players. If that's you, then teach it, film it. Absolutely film it. See if you can get it to be repeatable. Okay. Filming is essential. It's something that that we work closely with. There's a company called Biokinetics, and they film and do biomechanical analysis on pitchers and hitters. And it is quite intense what they do, and they produce a phenomenal product that is highly accurate and allows for the most subtle details to be flushed out, insufficiencies, those kind of things in the throwing motion and the hitting motion. And one of the things that when talking to the owner and the founder of owner of Biokinetics, is that you cannot see this with the naked eye. You cannot watch somebody and be like, oh yeah, they're doing this, they're doing that. Now, yes, you can see certain things. I should say that you could see certain things, but one of the things that he has noticed is that they are able to determine and improve repeatable mechanics. And in so doing, they can then decrease arm stress by improving the mechanics and making them repeatable. So this is something to think about, Hank. I can tell you this little side story. We've got a pro baseball player in right now, exceptional athlete. All of them are exceptional athletes. All of them have very good mechanics and repeatable mechanics. And we have found that well, and I guess it's not just the one. We've had multiple of these athletes go through, training and filming and different things, both with biokinetics and some without. And when they have streamlined their mechanics and then made them repeatable, we have seen, and the way we can measure, we have seen dramatic decreases in their elbow torques and arm stress just because their mechanics became repeatable. They're basically using the kinetic chain to the best of their advantage, and it's allowing them to produce a higher output, velocity, spin rate, movement, those type of things on a consistent basis with lower arm stresses. That is exactly what these players are looking for. It's exactly what any player is looking for. But obviously, the younger the players get, the more erratic their mechanics get. And we understand it's always a work in progress. We have pro guys every morning that are working on their mechanics. These guys have been playing for 2 decades, right? So, Hank, great question. I would tell you right now, if there's one thing that I look for in our athletes to decrease arm stress, it's their ability to repeat good mechanics of throwing. So I hope that helps. Hey, I really appreciate those that have come out and listened to the podcast. Appreciate those that ask questions. Please ask questions. We want to definitely answer any and all questions that we get to make sure that we get good information out there. If you do have specific questions, whatever you're listening to your podcast on, there should be a link. If there's not, you can go to the website, www.athletic-potential.com/podcast, and we'll be able to click a button there and ask your question. We appreciate those taking the time to listen. Please tell your friends, spread the word, and also rate and review on iTunes or Spotify. And until next time, thanks. Hey everybody, just want to say thank you for listening to the Athletic Potential Podcast. If you do have questions for the podcast, please visit the website, www.athletic-potential.com/podcast. You'll find a button there to ask your question. Please input your information and your question, and we will answer any and all questions we get. We thank you again for listening. If you do get a chance, please rate and review the podcast. And until next time, thanks.